Hey, New Care members. I wanted to give you an update by video instead of our normal newsletter. I think these videos will be a lot easier for people than reading through all of the stuff I typically write, which I know can be a lot. Well, today's topic is tuberculosis or TB. If you haven't been aware, there's been some media reports of an outbreak in the Kansas City area of tuberculosis, also known as TB. I'll use those terms interchangeably here. And that sounds pretty scary, right? I mean, we don't typically see tuberculosis or TB very often or very frequently, but in the last few months, they've noticed that at least a couple hundred people have been confirmed infected in Wyandotte and Johnson County. And this infection is nothing new necessarily, but traditionally or historically, it's only been found in specific populations such as homeless people, people using illicit drugs, people in prison. And occasionally we will find it in people who interact with those groups of people through an occupation or an activity. So healthcare workers, people who work or volunteer in a homeless shelter, people who work in a prison. However, when we have an outbreak like this, it can be a little scarier because people worry, I have this nasty cough, it's not going away. I read in the news, there's a tuberculosis outbreak. So when should people be concerned? When should people get tested? So let me give you a little bit more information there. Hopefully it provides some reassurance and lets people who need to take action, but not be worried otherwise. So how does TB spread? Well, it is contagious through the air, like many other respiratory infections. So if a person has an active TB infection, and they're sick and coughing, and someone else is interacting with that person, typically in a pretty close proximity for a prolonged period, there is some chance that they spread that bug to another person through respiratory droplets. However, this is not spread quickly like most viruses, so it's not nearly as contagious as something like influenza, COVID, or the common cold. So when we say exposure in this setting, typically we mean someone who's been in close quarters, same room, or speaking to that person for more than 10 or 20 minutes. What are the signs or symptoms of TB? Well, this is where it gets a little bit tricky because as a respiratory infection, it has many of the same signs and symptoms that other respiratory infections have. But typically, TB is going to cause a very productive cough. And by productive, we mean lots of mucus and phlegm. It's going to cause unintentional weight loss, pretty severe fatigue, low-grade fever and chills, and really profound night sweats. I mean, soaking through clothes and sheets. So you might say, well, these symptoms are pretty similar to other pneumonias or other infections of the lungs I've had. And you'd be right. One thing that's pretty unique about tuberculosis is it really, although being a scary infection, tends to be very gradual in onset over a few months. Whereas opposed to people with more common infections tends to be more quick in onset. Bronchitis will usually start as nasal sinus symptoms or a sore throat within the coughing onset, and that usually gets better within a few weeks. There's been another infection recently called mycoplasma or walking pneumonia that's been in the news, and that can also cause similar symptoms and linger for a few months. So, what are we supposed to do about this? When are we supposed to test for TB based upon the symptoms? I would say if a person has those classic symptoms of TB and they're higher risk based upon their occupation or potential exposures, we would recommend a TB test for sure in those people. But what we're hearing is more people who just have a common cough, sometimes even for a few weeks, and they haven't had known exposure. In most cases, I don't think these people need to be tested. However, if we are going to do testing, there's other things I would consider, including testing for mycoplasma, pertussis, also known as whooping cough, among other things. If a person has chronic health conditions or a weakened immune system, it might be more appropriate to test in those people because they're more likely to get some of these unusual infections. Regardless of the cause, if a person has more severe respiratory illness with high fevers, temperature of 101.1 or higher, shortness of breath, or chest pain, I would recommend an exam and possibly other testing, including a chest x-ray. If you're going to get TB testing, what are your options? The most common one done in the United States is a skin prick test, also known as tuberculin testing. And that's when they put the little thing under your skin, and within a couple days they look for a reaction. And this still is the best and cheapest option, especially for screening, but it may not be the best option if we suspect a recent infection or exposure. So for someone just doing screening who is low risk or without symptoms, this is still our best choice. And this can be done through our county health department for about $30. So it's a very affordable option as well, and what I'd recommend to a lot of people for general screening. However, if a person is sick or they've had known recent exposure to TB, what I'd recommend then is one of two things. Number one is a blood test called quantiferon gold. And this is a test where we have to draw blood, send it off to the lab. And this is a very specific test for tuberculosis. And our patients, when needed, can get this done for about $80. So a little more expensive than the skin prick test, but much more specific to active TB infection. Another option to consider here would be a chest x-ray. Chest x-rays, of course, are pictures of the lung. And these are not looking only for tuberculosis. They're looking for any type of lung infection or pneumonia. But TB does have a somewhat unique appearance compared to other lung infections. So that might be a good choice, especially if we're looking more broadly at pneumonia or other lung infections. Our members, depending on location, can get chest x-rays for anywhere from $60 to $100. So again, a little more expensive, but also looking for more things. If someone's getting lung testing, I probably would put other things above TB, including things like pertussis, which we can test for with a nasal swab, mycoplasma pneumonia, which is a blood test, an antibody. If a person's acutely sick, also testing for things like flu and COVID would be very reasonable. And we can review all those tests with people depending on their circumstance, and those each have their different costs. So I hope this information was helpful and reassuring. If you do have concerns or symptoms or exposure, of course, reach out to us and we'll arrange the appropriate testing.